Hello, our centre has noticed a change in the incidence of Morton's neuroma when comparing men to women. Find out more in this video. Hello, my name is Ron McCulloch. I'm a consultant podiatric surgeon specialising in Morton's neuroma. Our centre is very interested in finding the causes for Morton's neuroma, and we have a lot of very sophisticated technology, including gait analysis technology, to try and establish why the condition occurs, because that way we can treat it most effectively. We also offer a number of very advanced minimally invasive techniques to avoid the pitfalls of more extensive open surgery, and this of course includes cryosurgery, radiofrequency. But this short video is just about the incidence of men versus women, as some people might be interested to find that there has been a bit of a shift. So 10 years ago, when we did an extensive survey as part of an audit, part of a master's degree in fact, we discovered that the incidence of women to men was about 80% women. That's pretty typical for what we see in the studies as well. However, we did a survey again a few months ago and the incidence has changed, and now we're seeing about 60% women to 40% men. So the question is, why is this occurring? And I think there are a number of possible reasons. Firstly, we have noticed a shift in the type of shoes that women wear. We now don't see ladies wearing high court shoes and pointed shoes quite so often. And also, even if they do, I think there's more of a shift towards them wearing them more at work rather than to work, and just making lifestyle changes. I think that's one factor. I think also there's a better understanding of Morton's neuroma. People are actually discovering sooner what they've got through the internet and channels like our YouTube channel. And as a consequence, they're being managed quicker, and I hope that's also having a positive effect. I also feel that COVID could have had an influence, because there is now a lot more working from home, and so the amount of walking that people are doing, particularly perhaps in shoes that aren't ideal, has reduced. Conversely, in relation to men, we're probably seeing a slight increase, which is also interesting. I think that's a lot to do with lifestyle and sporting activity and recreational activities. For example, we're seeing more Morton's neuroma in road cyclists, and we do see more road cycling in men than women. Road cycling can be at quite high risk of developing Morton's neuroma because of the continual forefoot pressures, and I have done videos on this about how to mitigate some of those risks. More generally, we're also seeing an increase in running, and I think that barefoot shoe technology has played a role in some instances increasing the incidence. Certainly these type of shoes can increase the risk of Morton's neuroma if you're predisposed. So if you're not predisposed, in other words, if you're mechanically, you've got a good foot shape, you haven't got an abnormal toe length, you don't have a particularly wide foot, you may well be able to wear barefoot shoes, especially if you run on natural terrain. If your foot mechanics aren't great and you run on concrete and on roads a lot of the time, then that's a good way of getting Morton's neuroma. And we do see quite a high incidence in patients who decide to do barefoot running and who don't really have the right kind of shoes, and as a consequence, the pressures go up massively. And when we do our in-depth gait analysis, these are things we see. So I hope this video is interesting. It's just really to understand perhaps why there is this change in incidence, as it may of course relate to the type of patients we see and the way that we manage the condition.